As the cases start to rise again and more people are getting vaccinated, the debate over who should have access to that information continues to grow. Should the need and the right to privacy trump the need for safety in healthcare institutions and our schools as the pandemic continues?
I really think that as a health worker, our job is not to be a vector for COVID-19 or any other type of infectious disease, and our fundamental duty is to protect our patients from any harm.
Many in the healthcare industry have suggested that it be mandatory for those working in that profession to be vaccinated. And yet, Ontario Premier Doug Ford continues to push back on it being a requirement in any workplace. That has now prompted professionals on social media, including Dr. Michael Warner, to suggest that if governments won't protect patients, patients should be empowered to protect themselves.
Instead of placing the burden on patients to ask healthcare workers or custodial staff or personal support workers whether they've been vaccinated, patients should just be able to make it known that they only want to be cared for by people who are fully vaccinated, if that's their choice. And if that's their choice, it should be respected.
The return to school in just a few weeks has also prompted questions about whether teachers and school staff should have their shots before getting back into the classroom, and the rights for parents and students to know.
We certainly can ask for information. It's up to the individual at this point in time whether they do want to disclose that information. It is, of course, personal health information. And so we know that people, whether they are vaccinated or not, actually, may choose not to disclose their vaccine status.
Reasons for some to keep that information close to their chests could be an underlying medical condition that prevented them from getting their shot. And that information could leave them stigmatized.
Just recognizing like the health professionals and the teachers, the way they are kind of like in a different level, so to say, I feel it's important for us to know for them. But for everyone else, just understanding that there's a lot more considerations.
If I'm going someplace and into an office and there's 5 unvaccinated people and me, do I want to go there? So in this case, I'm leaning more towards, I think for the greater good and for how contagious it is and how devastating it can be on people, I think yes.
Some say it depends on the type of workplace you're talking about.
These are professionals. They come from professional bodies. There's standards of care, standards of practice. Like we, as a society, we at some point have to rely on some trust and faith in fellow human beings and fellow institutions that have been created exactly for these circumstances.
It's not enough, though, says at least one professional on the front lines.
The public institutions that people work in should be maximally protected for those patients or those residents, full stop.
When it comes to bringing students back into these environments, the Toronto District School Board says it will not be providing any vaccination information on teachers or students. In fact, the only area in all of Ontario that will be doing so comes from Wellington Dufferin Guelph Public Health Unit.